Hi, I'm Tracy, a midwife at Monash Health. The last few weeks of your pregnancy is an exciting time. You and your family will be preparing your life and home for a new baby. It's also a time of preparation for your body as it undergoes some changes and becomes ready to give birth. You'll need to be prepared for the birth a few weeks prior to your due date. Labour usually takes place sometime around 40 completed weeks of pregnancy, but any time between 37 and 42 weeks is considered normal. You will need to make sure your baby has a safe place to sleep, has clothes to wear suitable for the current climate, you have a bag packed ready for your hospital stay, you have an approved child restraint installed in your car to transport your baby home, and that you have your pregnancy paperwork and hospital phone numbers ready. During the last few weeks, we recommend you spend some time thinking about some of the things that are important to you during your labour and birth. If this is your first baby, you may have attended childbirth education or read some books or the hospital pamphlets. If this is not your first baby, you may have an idea of what you might like or not want in your labour or birth. Your pregnancy care team will also spend some time discussing and planning your labour and birth. If you have any questions or worries, ask your midwife or doctor. Ensure that the people that are going to support you in labour understand and accept your wishes and preferences. You may like to write down your preferences as a great way to let the midwives and doctors know your wishes. Giving birth is a bit like planning a journey where you know where you are starting from and where your destination is, but there are many different roads you can take to get there. Individual circumstances can change quickly, so you and your care team will need to be flexible with your birth plan and consider some alternatives if there are changes in your baby's condition. You'll be able to make the best decisions when you have the right information about your health and your baby's health. Don't be afraid to ask a member of your healthcare team any questions you may have. Over the last few weeks, you may have noticed changes in your body. You may find breathing easier and you may be hungrier as your baby starts to settle down into the pelvis, ready for birth. Your friends and family might comment that you've dropped. You might notice that you start having or have increased Braxton Hicks contractions. These are tightenings in your uterus that are not associated with your cervix opening. These Braxton Hicks contractions are generally mild and come and go. If you are worried about the abdominal pain or contractions, or think you could be in preterm labour, please call the hospital and talk to a midwife and discuss if you need to come in for an assessment. You might notice your vaginal discharge increases. You may also notice some sticky mucus discharge with or without some small streaks of blood. This is a good sign that your cervix is getting ready for labour. You will only need to call the hospital if you have any watery discharge or bleeding that looks fresh or like a period. They will probably ask you to come in for a checkup. If everything is normal, you'll be able to go home. It's important to monitor your baby's well-being during the last few weeks of your pregnancy. By this time, you will already know your baby well by the type and frequency of movements that your baby does. A reduction in your baby's movements can be an indication that your placenta isn't supplying as much oxygen or as many nutrients to your baby as it was. If you feel that your baby is moving less than normal, you need to call the hospital as soon as you notice a reduction. We will ask you to come in so we can check your baby. You may be asking, what happens if I go over my due date? At Monash Women's, induction of labour for prolonged pregnancy is generally not recommended until at least 10 to 14 days past your due date. There are tests that we do at Monash Health, like CTG and amniotic fluid index, that can help your healthcare team decide whether it is safe to wait for labour to start or whether you might need to think about induction of labour. Induction of labour is a medical process used to start labour artificially by using drugs or special instruments. In most pregnancies, it is best if labour starts naturally. Induction of labour will be discussed and offered when continuing the pregnancy is thought to be more risky than inducing labour. Our information sheet on induction of labour can be found on the Monash Women's website. Most importantly, try to relax and enjoy the last few weeks you have your baby to yourself. Try not to worry about labour and birth. It's an exciting journey and you can be confident that women and maternity care have evolved to make giving birth safer at this time than any other time in history. At Monash Women's, we will work with you to make your birth a special time to remember.